This is a very long time has passed. I haven't had a video in my presentation, so it's only PowerPoint slides. So it may be boring, but I would like to share why we have to approach differently about prostate cancer. So my patients in Korea always tell, oh, prostate cancer, it doesn't kill, you don't need to treat. But I think we have to approach differently. So in Korea, the prostate cancer is number 5 cancer. So I don't know about in India. In Japan, it's number 3 cancer. In United States and most of the Western world, it's number 1 cancer. There's an intriguing phenomenon in Korea. The 5-year survival rate for prostate cancer is very, very low. For the early 2000s, it was only 67% 5-year survival rate compared to 99% in the United States. Now it became around 85%, but still we're lagging about 10% behind. So we attribute this phenomenon for delayed in screening, maybe different behavior. If you look at it, I think we do see more Gleason, the 8 cancers, 9 cancers, and 10 cancers compared to the other groups. I think comparing with the Japan, Dr. Egawa's group, I think we see the similar phenomenon. So the Eastern Asia, we do certainly see higher stage patients. When we analyze our data in Korea, I'm sorry about the overlap, we break down into 2 groups between 2003 and then 2004 afterwards. We did see significant downward trend in our stage and grade of prostate cancer. So maybe in India and other parts of the Asia, maybe you would probably see the downward trend in Gleason score and stage later on. So we actually still see about 10% of our patients are Gleason 8 or 9 and 10, so it's pretty high. So is the more aggressive? I think yes, because if you look at the red area, which is a highly prevalent prostate cancer societies, we are on the yellow area, which is a little bit more than the green area where the India and China and rest of the Asia stands. If you look at, it's a very famous studies about the African American men has a higher stage the behaviors. The mortality and mortality, I think it reflects that the aggressive disease in the African American men. So if you compare the apple to apple for the African American men to the white American men, the cancer volume is actually higher. There's a higher Gleason stage. But if you look at the Asian American ethnic groups, the Koreans actually have the lowest incidence of prostate cancer. Compared to the non-Hispanic whites, the Filipinos, Chinese, the Vietnamese, the California Cancer Registry shows that we do see lower incidence of cancer in California at least. But if you look at the mortality rate, even though incidence rate is only half, it's following quite closely to the non-Hispanic whites. So I think there is we can explain this by, it's probably a more aggressive disease for the Asian American men residing in California. If you look at the Japanese data and then Hawaiian Japanese and Japanese residing in Los Angeles and the non-Hispanic white data, there is a trend. Dr. Tuari explained in his publication that in Japan, people actually see a much lower incidence of prostate cancer compared to the Japanese who have descended to Hawaii some 100 years ago, has a higher incidence, but it doesn't actually quite catch up with the non-Hispanic white incidence in America. I think this study can be duplicated for the Indian population, Korean population, and other Asian ethnic groups. So if you look at the Chinese group in America, the trend, echoes again. The Chinese men, the mortality is just 1 compared to the Chinese American, but it is significantly lower, probably only 30% of the non-Hispanic white men mortality. So there is a great discrepancy between the cancer behavior here. So if you look at the more military-based study of more than 10,000 men, even though there's a limitation of different Asian subpopulations, no data about diet, and no cancer-specific survival rates, we do see in altogether Asian men, again, A little bit higher incidences of Gleason 8 cancers, Gleason 7 cancers is evident in Asian American population. And then if you look at it, there's one interesting phenomenon here. The Asian men, at least in Korea, prefers to have prostatectomy rather than radiation or other modality of treatment. I think it's a cultural thing. You want to take the cancer out. There is another economic issue, is radiation therapy more expensive. But I think, overall, the Asian men, at least in east part of Asia, likes to take their cancer out rather than going through radiation therapy or other modality of treatment. So that's why the brachytherapy is not very popular. Watchful waiting is not very popular either. After prostatectomy, the grades goes lower. So it's very, very mixed, wide data. We cannot explain most of the findings, but we found that the Asian, is probably selects towards to take the cancer out by surgery. If you look at the race, there is a higher risk for the African American men in America. If you look at so how we can explain this differences? Is it genetic, biological, environmental, the diet differences? So how can we reduce the incidence and how can you reduce the mortality? I think we have to look at the susceptibility and the treatment outcomes as well. Explaining the racial differences, many papers on the DNAs and the genes, the axes, but I think it cannot beat the genetic predisposition. I think you are born with, highly susceptible prostate cancer person compared to the, lower susceptible person. And then there's a great dispute about the environmental, the diet, socioeconomics, treatment, health-seeking behaviors, cultural, and the language barrier to reach the physicians as well. So disposition, the first degree relatives have a 2.5 more chance to get cancers. And then genes, I don't even know the acronyms, but there are many genes explaining prostate cancer. The androgen levels was looked at very closely in Korea. And then because many people thought that beans and tofus and the diets we have, maybe that explains that lower androgen levels, thereby having lower cancer rate. We couldn't quite successfully prove this theory. But I think the diet was true. When Dr. Walsh was in Korea 2005, one of the media asked Dr. Walsh, what could you give to the Korean population to prevent prostate cancer? His answer was very straight and simple. Keep on eating Korean food. I think going to the hamburgers and the hot dogs and the American, the westernized diet, it probably is not very good for prostate cancer. And then obesity is another factor that we all understand. And then the influences of the socioeconomic status, the tobacco use, inactivity, the less access to the fruits and vegetables, and then the healthcare issue is a really important issue in Asia. I think the preventive care and treatment, I think this is a multi-fronted battle. We have to fight with the prostate cancer. So I think there is a non-modifiable factors we cannot change. We are born as we are. But there are some modifiable factors. So I think in Asia, even though maybe it's more aggressive, we can counsel our patients to do some lifestyle variations, maybe diet changes afterwards, or less aggressive, maybe different modality of screening. So I thank you very much. I thank the Vaticuti Foundation and Institution and Dr. Menon and Henry Ford Group for making all this possible. Thank you very much.